what we're going to do is talk about the process of claim submission, and then we'll go back through the finer details of making that happen. And we'll talk about process, and if you're in a group practice, how to decide if this is an administrative process or a clinician process. So with therapy appointment, the main idea is that if you're an independent clinician, that you can do everything you need to do for billing and submit to the insurance companies. And we had another webinar that we talk about how to set up for that connection. So we will not be covering that today. This will assume that you are already connected for insurance processing with therapy appointment with our clearinghouse office ally. So the process is, number one, you need to have a patient on your schedule, and that patient needs to be assigned as an insurance patient in order for a claim to be created. So let me go ahead and put a patient on my schedule today. It happens to be Rocky Balboa. And if we take a look at his information page by clicking display, we will see that it says who the insured party is, and he has Aetna as his insurance company. Okay, so that is how we know that this is an insurance patient. So the fact that this patient is on my schedule today, and he has Aetna selected as his insurance company, means that when we do this process, that we are creating a claim for Aetna. Okay, so Rocky is on the schedule for the date of service, and his line is blue. And if you are a clinician and you're using our charting process, then what you'll do is you will click the chart button, and you will complete the chart note screen for the service this day. So billing requires several things. Over here on the left-hand side of this charting screen, it requires a CPT code that's billable to an insurance company to be selected, and selecting the CPT code will automatically fill out the usual and customary fee over here on the left-hand side of this charting screen. Okay. So if I were to choose, for example, a 90791 instead, then I would see that that fee changed accordingly with the CPT code selected. Okay, so highlight the code in order to select it. You can only highlight one code under CPT per session. Next, you have a units button, which is going to default to 1. This is about how many times you're billing this particular session for today. And this comes in handy when, particularly if you treat you provide testing services, and typically you bill in units of hours of testing. So for example, if this were a testing situation, I would be billing in 3 units of time, for example. Okay, that automatically adjusted the fee accordingly 3 times 100. Okay, so this is going to default to 1, and 1 is typical for most of us when we're seeing patients. Next, you have a POS button. Now, this POS is going to be a coding of 2-digit numerals that indicate if this was supplied at an office, and it's going to default to code 11. You can adjust for other codes. And in this particular case, we have this particular clinician is part of a group, and this group has more than one location. And so they're going to indicate that location information on this particular screen. And it's going to default to the location that's on the top or the main location. Okay, so this is my Fort Worth location. Next, we have room to put a one-time modifier code on a particular claim. Now, in the insurance database, there's a place to always enter a modifier code whenever you bill a particular insurance company and this particular therapist. So this is fairly rare for most people, but if you need a one-time modifier code to go on this claim, you can type it in here. Typically, it's a two-character code. It may be alphanumeric. And then you have an add-on code listing here. So these add-on codes are CPT codes that are billed in conjunction with another CPT code. And for example, add-on code 90785 is interactive complexity and can be billed in conjunction if you meet certain requirements and for conjunction with a 90834, for example. And then we have PQRS. So PQRS is only of interest to someone who is billing Medicare and participating in their PQRS reporting system. They have several codes that can be billed with claims on the claim itself, and they are here. And if you need to bill multiple codes, you will just click that code and then click the control key and click other codes that you're going to be billing on this particular claim. Okay, so again, that is only for Medicare circumstances. Right down at the bottom left-hand corner, we have a Code Help button. And this Code Help button brings up a page, and it tells you what these different codes are and their descriptors. So here are the common CPT codes used in mental health settings. Here are different place of service codes in case you're treating an inpatient, like a nursing home. Here's add-on codes and their descriptors and what codes they are typically billed with. And here are some PQRS codes and their descriptors. Okay. So I may or may not have PQRS coding here. I could just end all that. Whoops. So the next part is over here on the right-hand side of this charting screen. You will see an amount past due. This is an amount that is owed by the client, is not expected to be covered by insurance. It's going to include services that are not covered by insurance, such as like cancels and no-shows, and then co-pays that the patient failed to pay after a claim, and a claim's come back for that claim. And then you have the fee. Again, remember, CPT code drives the fee. And then you have an amount the patient actually paid you at the time of service today. So it may have been $40 plus some of this past due amount, or the $445 that you collected. The amount the patient actually paid today is listed in this box. So let us assume that the patient paid their $40 copay today, and I will mark the form of payment cash, check, or if you're on our not in our integrated credit card processing system, you'll have a button here that says credit card. If you are using our credit card system, you will have a button here that says charge card on file if there already is a card on file, or an enter credit card button at the top to enter a card for the first time if you're integrating. Now, as a clinician, you may want to enter this information and come back and write your chart note later. So I'm going to demonstrate that right now. I'm going to hit the button that says chart this, and I'm going to get a warning, caution, errors were detected, no substantial progress were entered. Okay, and I understand that, and I'm going to hit continue. So what happens here is my patient went from blue to yellow on my schedule today. And that indicates that I've entered in CPT codes and billing information, but I've not yet completed a note. The fact that you got this far in the process means that a claim has been created in the system and is being held in our system for Rocky Balboa's service today, May 25th. So in order to see that claim, we can go to the blue column of navigation buttons, and we can click this button that says Claims. Now you will notice that a warning comes up that says, really, you want to click this button rarely? Your normal process of submitting claims is going to be by locking the day. And so we're coming here right now just so I can demonstrate for you the claims that are in queue waiting for submission. So right here at the top, it says Select Insurance Claims to Process. And then I have a very colorful screen here. So in this case, these are claims that are being held in queue. They are not yet submitted to the insurance company, and this is a place to review claims that are waiting for submission. So claims here are color-coded as to their readiness for claim submission. So what we'll see here is green means good. Green means ready to go. We don't detect any problems with this claim in order for you to submit to that insurance company. However, red means there is a problem we're detecting, that something is missing that is necessary for claims, and we'll let you know what that is. For example, you're missing a primary insurance ID number and it has not been entered. Okay? So we will let you know if it's missing something and warn you not to submit that claim. You'll notice that on the right-hand side there are some check boxes, and these check boxes indicate that if it's checked, when I go down to the bottom here to hit Submit Claims, only the claims that are checkboxed will be submitted. The rest will be saved in this queue waiting for you to make some decisions about them. Okay? So if you'd like to force a claim to go through, even though you're getting a warning, you can click the button and get that claim, force that claim to go through when you're ready to submit. Okay? So let's get out of this box here for a second. And in order to do that, I'm just going to hit Display down here in Rocky Balboa and get his information back to the top of the screen. So you can see that that claim is in queue waiting. Okay. Now, if you are using chart notes in the system or you're documenting on paper, remember that a typical insurance contract does state that a service is not complete unless a note has been written about the service. So with our system, we have a recommended way of going about submitting claims for this particular therapist. So we can see very quickly here by the color coding on today's date that there has not, this data service for Rocky Balboa has not been charted on because it's yellow. When the service has been charted on, it will turn green. So I'm going to go back in as a clinician, and I'm just going to click this button that says chart, and I'm going to choose a chart note format, and I'm going to type a note in here, and let's see, I'm just going to copy some text off that I can put in there because I want it to look like something, okay? And I'm going to chart my note. So we will see that my chart entry has been accepted and continue. We do cover charting in another training. So everything is green for the day, and if this is all the patients I have today, then I can be done and submit these claims. So what we'll do is we will go right over here to this button that says End of Day. So this End of Day button will review the date on the bottom half of the screen. So if I click this for today, it's only going to review today. If I happen to be back looking at yesterday, it's going to review yesterday. So we'll see yesterday I had two patients. They're both blue in color. I have not done anything to indicate that the patient had a service that day. They're blue. They're not yellow. So there's no claim that has been created for these patients at all yet if they happen to be insurance patients. Okay. So if I click this End of Day button over here for Tuesday, May 24th, I'm going to get a warning that uncharted sessions are there that day. Okay. So I need to chart on them, and I can click the button in order to do that. Now if I go to this button that says Next and I get back to today and I click End of Day for today, I get a screen that looks a little bit different. It's going to tell me, hey, all patient charts for Wednesday, May 25th are complete. And here are the patients that you billed, their diagnosis, CPT codes, fees collected, notes were written, and insurance in effect. Okay? So this is a review, and I can take a look at it and see if there's anything I might want to change based on this review. So let's assume that maybe for Rocky Balboa, I intended to bill an add-on code. Okay? So let us go back to this chart button, and let us go down here and go to add-on codes and choose the 90785 add-on code and add that into the chart note. Now I'll go back to this End of Day review, and it's now going to have that add-on code included as a CPT code for Rocky Balboa. Now if everything looks wonderful, I am done, and I can lock these records. Okay, so locking means I can't edit those chart notes, but it's going to mean I can review I and review everything on this page that needs to be reviewed. Now, once my chart notes are locked, those notes turn gray on the schedule and I no longer have a chart button. But if I want to edit a claim before it goes out, I still have an opportunity. And the opportunity comes in like this. Let's say that I have a claim here for Cindy Ball and it should have been a 90837, or Rocky Balboa should be going out on paper instead of, or electronic instead of paper claims. So here's where I can change several of these things. So to change the type of submission that's going out for this particular claim and any claim under Aetna, for example, I would go over to the insurance button on the left. I would choose new insurance company and click on it and choose Aetna, and then click here after selection to bring up the edit screen. And then I would go in and I would change this to electronic through Office Ally and click here when done. So that has changed it for Aetna, but you'll notice it hasn't changed on the screen up here because I need to refresh that screen first. So we'll go right here and click this Claims button again, and that will refresh the screen and we will see those change to electronic claim submission. So that is how you can change the submission type before you submit a claim. Now let's also assume that I would like to change the code that's being billed out for this session. Remember that if a session is locked, the chart note has documented this particular code already in the note. So when you change a code, you should also make an addendum to that note that day. So I'm going to go down here to Cindy Ball and I'm going to add an addendum that says this was billed as a 90837 service, not a 90834, okay? That's if you're ever audited by an insurance company that you've documented that. And I'm going to chart this. Okay, that did not change the code. What will change the code is I will go to Cindy Ball's information page and I can get there right from the schedule. I could also go to Old Patient to get there. I'm going to click on the posting screen, and this is going to show me the claim that's held in queue is green in color. That means it's not yet been submitted to the insurance company, so I can make edits here. So if I would like to edit the CPT code, I can choose on this drop-down menu, and I can choose the correct CPT code to be billed. I will need to adjust my charge here, okay? And after I've made those changes, I need to hit the Post button. That is what updates the line and the changes, okay? So now let's go back to this Claims button, and we will see when the screen comes up that that claim has been changed to a 90837, and that's what will be billed out, okay? So I'm going to bring my schedule back down to the bottom. So when you are ready to submit claims, all you'll need to do is click the button, right? Now we have a claim sitting here under Jessica Aranda, and it's going out to Health Management Corporation. It's as a simple list, and it says I'm missing a primary insurance ID number for this patient. So what I'm going to do to fix it is I'm going to go to Jessica Aranda and bring her up as a patient, and I'm going to click on her information page. Now, information about a patient that we're telling you this is missing, you will go into this Edit Info screen, and you will see the areas that hold information such as diagnosis, patient address, primary insurance policy information, and this is where you'll find an ID number, group number, effective date, so such things. So I'm going to enter in her insurance ID number. Maybe I didn't have it. I gave her a phone call and found out what it was, and I've entered it here. And when I save my change, I'm going to get a review. And if this patient is under insurance, then I'm going to get a review that says it looks like everything I have is sufficient to file claims for this patient. And I'm going to hit continue. So now we'll go back to this claims area, okay? And we will see that that claim on Jessica Aranda, yellow means this date of service has been submitted to the insurance company, and you're still within the wait period of finding out about payment. And if you remember in setup, I recommended for electronic claim submission that you tell the system to have 30 days between the time you submit a claim and marking it as a problem. Okay, so these are some typical things that we would see in this claims screen to process that we might need to fix. All right, so we have another one on Enable that says this date if we need to submit it. So that's right here, 4/16/16. I would do the same thing. I would hit this alter button. I would change the insurance in effect to the one I needed to bill, Blue Cross Blue Shield of Texas, and select for this claim. And then let's go ahead and click this B button to rebatch that claim. And again, when I refresh that claim screen, what we're going to see is we are going to see that red Enable on 4/16 in that queue. As we refresh it, we will see that it has been changed. And she had 2 dates of service on 4/16 here. We had an add-on code, so don't forget to change the add-on code as well. And click Alter and make that change. Okay, so this is a rare thing you'll have to do only in situations where you actually have a patient who changes insurance, or maybe you just assigned the wrong insurance to begin with. So that's how you would change that in the system. Okay, so we will go ahead and make sure that that's included. All right, so we're going to go ahead and hit this claims button here. And there, that took that add-on code away. It's being included in this data service. So those are ready to submit in my next batch that I go out and submit. Okay, so let's go to the next step here. Let's assume I've just submitted a batch of claims like I did a little bit earlier. So at that point, we're tracking claims. And Office Ally, our claims clearinghouse, which receives those batches, they're going to send you emails about the fact that they just received your claims. And that email is going to look something like this. Hey, supported Office Ally, we just uploaded a batch of claims for you. Okay, cool. I'm going to delete that. Don't need it. And then a little while later, they're going to give me another email, and it's going to say, hey, we just processed that batch of claims as well. And you had a claim going to Blue Cross and a claim going to Aetna, and here's, they were accepted, no problems. Okay? Now, all these notifications you're getting in emails are also going to come through to our system as and held in a button that says Clearinghouse. And to get to this Clearinghouse screen, you're going to go to the gray column of navigation buttons and click Clearinghouse. Now, you will only have this button if you are an independent practitioner and you are going to be receiving the messages for billing. If you are in a group practice and these messages are going to probably the person who set up the account for you to begin with, and if you need those messages to come to a different person, please send us an email about that and we'll take care of it. So if I click on this clearinghouse screen, what we need to do here is bring up a screenshot of a real situation, because I am not sending bogus claims to insurance companies and really getting these reports back. So here is what it would look like. When I sent a batch to Office Ally and they accepted the claims, I would get a report here and the date, and it says insurance acceptance. And you'll notice that we have one in red here. It says insurance rejection. So that means we thought we had a problem with a particular claim and you need to fix it. Okay? So this problem, whenever there's something like this that occurs, you are going to get a message in your messages button down here in the lower left-hand corner. And it's going to say urgent message, and you're going to read that message, and it's going to look something like this. The clearinghouse reports that you had electronic claims rejected because errors. So click here to get to the message. So if I click this button, it will be the same as going to this clearinghouse screen and clicking this button and to review the message. So let's review that message and click on it. So I'm going to get a listing of the claims I sent out who they were sent to. I had 3 claims to Blue Cross, 6 to United Healthcare, 7 claims were accepted, 2 were rejected, and here is the rejection code, error RC07. And down here it's going to tell me about error claim details. And so I'm going to be able to see the patient's ID number or insurance number, their first and last name, date of birth, date of service of treatment, and the CPT code that was billed. And there would be their diagnosis. This is an old one, obviously. Tax ID, account number, payer ID. This is the insurance company you billed, okay? And then the error code. So I can go exactly and see which patient and which date of service this is a problem on, okay? Also, the account number tells me about, if you're in a group practice, which clinician it was, okay? So all I need to do is figure out what this code means. So you have an example right here, duplicate code within 90 days. What does that mean? Well, these error codes for this come from Office Ally or Claims Clearinghouse. So in order to, if you want more understanding about these codes, here's what you'll do. You will go to, let me get some screens out here. So you will go to Office Ally's website and go to officeally.com. You don't need to log in. You'll just go to their support and click Support Suite. And in this, you can type that code, RC07, and I'm going to search, and it's going to bring up a result. And for all payers, that means for all insurance company, rejection for duplicate claim, a duplicate claim sent, and resolution. If you don't know how, we can walk you through turning off a duplicate filter. So, so that's a service at Office Ally. They have a filter there that if you fix a claim in our system and you try to send it again, it will catch it as a duplicate claim. And in that setup, I taught you how to turn that filter off, and you can also find out more from Office Ally about what to do. But these codes will be here, and they will tell you what they are. And so codes are going to be here that tell you what needs to happen, right? If I need to fix this, it means I go into my Office Ally account and turn that off. And you turn it off permanently, and you won't get a rejection like that anymore. Now, let's say you get a code, and the code happens to be an invalid zip code for state, okay? And I'm just going to type that in, and it's going to tell me about what those rejections are and you know what that billing code is. So you'll look it up and find that out. But if I get that code, it tells me what I need to do to fix the problem, right? So let's say that I got an invalid zip code for state. We need to do a little detective work. So that means on the claim itself, so let's go look at a sample HCFA form. And the way I'm going to do that is for any patient that you'd like to look at a HCFA form, so let's just say it happens to be Martha Washington here, that I'm going to look up. I'm going to go to her information page, and I'm going to go to the posting screen. And if I would like to take a look at a claim, I'll just go to this claim submit column and hit the button that says P here. And if I hover over that, it says reprint a single claim now. So I'm going to hit that. And it's going to bring up a PDF file for me. And the claims in the box and everything that's in the box will be listed there. So I have a lot of information here that I can look at, and where is there a zip code on this form? Well, there's a zip code up here in the insurance database. There's an insurance here for the patient. There's an insurance here for the insured, there's a zip code here for the insured party. And there's no other place there I see zip codes except for down here in service facility location and billing provider information. Okay, so there are 4 possible places there might be an invalid zip code. Your error code may give you an idea of what it is, but this is where we'd need to go check, right? So most typically when we get an invalid zip code for state, we're going to find out that we go to this patient's information page and click Edit Info. You're going to take a look at their address and contact information, make sure it matches, and you're going to take a look at primary insured party information. And I will guarantee you 99% of the time this is the problem, because it might be a different address in the patient. Maybe you put in a wrong state in there, so check both the state and zip code. Okay, so I would go to the patient's information, make sure that's correct. If it's not, I'm going to change it and save it. Okay, so maybe it's the insurance company information itself that's the problem. I'm going to go to the insurance database, click on Aetna, get here in order to look at the edits and make sure that's the right zip code. The other place I'm going to have a zip code is I'm going to be in the clinician preferences, and I'm going to make sure that my mailing address that I have for a 9-digit zip code, and I'm going to make sure under practice group preferences, if I'm a group, that I have that included correctly and it's not running into each other. Okay, so there's several areas to double check. So on a claim, in particular, where we're drawing information from, number one, if it's about the patient, you're editing the information under the patient's information page. If the problem is with your information, like your practice group information, your NPI, tax ID number, your billing address, that is all held under preferences, okay? And so this is where you would go to edit and make sure your numbers were correct and see what the problem might be here, okay? And then there is the CPT codes, and then also you have the insurance company itself. All right, so those are 4 databases that hold information that go on claims, and you get a clue by the rejection code where you need to go to figure out how to fix the claim. Okay, so that claim has been fixed, right? And I want to resubmit that claim. So what I'm going to do is I'm going to click here. I'm going to go to Martha. I'm going to go to the posting screen. I fixed that information, and I can just hit this button that says B to rebatch that claim again. And again, that's going to put it green, and it's going to be held in my claims queue now, waiting for submission whenever I'm ready to send it out. Okay? So this is how you work problems. Rejected claims will be notified. You will also see them under this clearinghouse button. And when you have worked a rejected claim, one of the things that I personally do with that is I will then just delete it because I've taken care of it. And everything about that problem claim has been identified on the patient's data. Let me show you more about that. Okay, so this particular claim rejection would have been listed for Martha Washington in the system. Now, I'm going to make sure of something here. Okay, and so if I go to Martha's posting screen, and let's just give you a reminder, we get to the posting screen by bringing up the patient's information page and clicking on posting. Okay, so I can take a look at this button that says Date Details. And this Date Details button on this posting screen is a wealth of information. I'm going to click on it, and it's going to show me everything that's happened on this claim so far. The transaction ID number, in case we need to help out with something and trace a claim through the system, appointment date and time, the patient's name, the patient's account number, the billable status, the CPT code, the units, place of service code. And let's say you need to fix some things on a claim. We have some boxes here, and we'll go through them. What you charge, the patient payment, how the patient paid, the check number, the insurance company name, insurance payment, none yet, no secondary payment, discount, none recorded, funds towards deductible, none recorded, posting status, in batch queued, ready to be submitted, okay, and insurance claim notes. So down here is where you will see everything that you've done to submit that claim so far. So you generated a claim on 4/8/16. It was a pay claim. It went to Aetna. Since it was a paper claim, we don't have any tracing information, but we let you know that's the date you sent it out. A primary insurance claim was generated on the 25th to Aetna, okay? So electronic or paper, however you're submitting out for this particular patient. So I can look at this and see all those information. So let's take a look at one. And if it was a not a problem, it would look something like this. Office Ally got that claim. It was a good claim. It assigned it a claim number and went to processing. Insurance company got the claim, and these were the comments. So everything you're going to see here is going to be that listing of, if it's a claim rejection, you'll see it listed here in red and what happened. Now, when you do resubmit a claim, if you've changed something on it, I do recommend making a note. And so let's say that I'm resubmitting this claim from Martha Washington. What I'm going to do here is I'm going to go to this Notes Correct button on the posting screen, and I'm going to enter a note. It's going to time and stamp it for me, and I'm going to say that the insured's zip code was changed by me. Okay? And for resubmission. Okay? And it even has spell check here since I obviously cannot spell. All right, so I'm just going to post that. That's now a note on that claim. So if I take a look at this Notes Edit button, I hover over it and see that note there. And if I go to this Date Details button, I will see that note listed down at the bottom there. So we're going to, you have all that information, who worked the claim, where it's at in the process. Okay? So that's going to go to that. So great, we have a question, and let me make sure I get that answered for you. So your question is, are claim notes only viewable by your agency, or insurance agency can see it too? That is only viewable by your agency. Those are not notes for the insurance company, okay, just for you. So if you have several people working problem claims for you or work different days, that you can make sure that if someone has to follow up, they know exactly what happened. Now, the other thing that you are going to have is every clinician has a bad claims button. So if you're in a group practice, bad claims is for each clinician individually. It's not a group bad claims. So for this particular clinician, I would click this button, and I'm going to see a list of problems. So these are not necessarily bad claims or rejected claims. They could be many different reasons these are problems, but these are areas that need to be worked, okay? And what you're going to see here, if there's a rejected claim that comes back, you're going to get a notification about it, and that should be showing up here. So if you are doing 2, 3 things, you are checking your messages, you are looking at that clearinghouse screen, and you are looking at bad claims, and I would recommend doing that if you have a large group practice, at least weekly for each clinician, and working on those problems, then you are never going to have anything fall under, fall between the cracks. You'll catch everything. So here we have a situation where we have some transactions that have problems. And this is a insurance company that was in effect for that data service. The patient's name over here, the data service. What we'll see here is the last time you sent a claim out for that particular data service, CPT code you billed, the charge, the patient payment. If insurance has made a payment, it would be listed here. If there were any adjustments taken, it would be listed here. And here it says insurance none. So in other words, we sent this to an insurance company, and it's here because insurance is not paid, and it has been over 30 days since we last submitted this claim. So it's sitting here as a problem. Okay? So the problem is when we look at this, anything that's in this list, if the patient were to receive a statement, they would be billed for this particular amount on that statement. Okay? So that is then assigned to them to pay. But maybe this is a place where insurance just didn't cover it. So insurance hasn't paid at all. So I would be checking, did I send to the right insurance company? Did the claim get where it needed to go? I would be looking at all those things, and I can follow up by that. This data service button here, this is the same data service button we saw on that patient accounting or posting screen. So clicking this will get me to the same place, and clicking the name will get me right to this patient's posting screen. So let me show you how that works. I'm going to click Amber Anderson. I'm going to get right to this particular posting screen, and we're going to see the information here on the screen. Now, I am in a practice account And people play in this all the time, and they cause all sorts of unusual, weird errors and circumstances. So what you would see in that list of bad claims is I should see that also showing up on this particular posting screen as red in color. So here we go on Dennis Stumphy. So the other one I chose, someone's messed around with it. So this is red because it's a problem, and it's also on the posting screen. It's a no-show. A patient hasn't paid for it yet, and we need to make sure it's still being assigned to them to pay. All right? We're going to cover accounting in another session, but I want to show you how that works. Now, one of the things that you have in this bad claims list is you have clues about what the problem is. We can see, for example, here that we did not send a claim on this particular service, so there's no insurance in effect, but we have an insurance payment that came in. This doesn't make sense. Again, it's a practice account. We'll go to another one. So here is Cinderella Ball. Date of service 10/13. Last time the claim was submitted 10/20/15. Patient paid 0. Insurance did pay 25 and adjusted for contracted rate, and that was done on 12/4/15. The patient has not yet paid a balance for $50 on this, so it's showing up as a problem. Okay, it's not really an insurance problem, but it is a follow-up problem because this was an insurance claim, right? So here we see one where insurance paid 0, patient paid 0, but there was an adjustment and insurance payment was received that said 0 paid, and there was a secondary insurance payment made here, and there's still a session balance left. See this little star over here on the right? I can hover over that and see all those notes about that particular claim without having to click on this data service button. So you would work this problem. Here is one where we have a credit balance for a patient. We'd need to go and distribute that to pay off other sessions for that patient. Most likely, maybe they're due a refund. Okay, so this is a screen you're going to work. So between this and the clearinghouse and your messages, you won't miss anything. Okay, so let's take one more example, and that is, let's say that you have insurance come back, and they give you you get a message that says, hey, insurance, you get an EOB in the mail, and it says insurance paid 0 because they don't cover this service. Or you get an explanation of benefits that comes in electronically to us, and you get a message that insurance paid 0 for this service because you're not covered for that CPT code, for example. And maybe what you realize is you made a mistake. Okay, so I have a screenshot here for you of what that might look like if insurance came back and said we're not covering that particular service. And I thought I had one for you. Okay, so it would look something like this, but you would have a warning here, and that would have come in as a problem claim, and you would have had a clearinghouse message about it, but it would have told us, hey, 90837, you're not covered. Okay, whoops, I didn't mean to bill it out as a 90837. I meant to bill it out as a 90834. So the insurance, though, got that claim for a 90837 and said, we're not paying it. So now I need to correct the claim. So you correct a claim when the insurance company has already paid it or sent you a notification that they're not going to pay it. And so how you correct a claim is you would go to the posting screen for that patient, identify the data service, and we have this notes button before, and it says all correct. So you would click edit, and what you would do here is you would go down here to say corrected claim, and you would say yes, replace the prior claim. And you're going to put in the claim reference number that the insurance company gives you on that explanation of benefits. So let me show you what that would look like. When you get an explanation of benefits, then you are going to receive something that looks like this. And you're going to see the claim control number here, and that is typically the number you need to put in that box. So different insurance companies do it differently, so you'll have to search on your EOB for that claim number, okay? And that claim number goes in this box, so let's just, usually a 10-digit number, and you're going to put it there, and then you're going to hit post this, all right? So that's going to mark this claim for a correction, and it's going to edit the claim form and put information on that claim that needs to go on that form automatically to mark it as a corrected claim so you can send it back through. And so if we look at this date details button, we will see that for this date details that we will see that, hey, resubmission code 7 was entered for original claim reference number here. So this claim has had this added to it now. And so when we submit that claim, that information as a corrected claim is going to be included in the electronic claim process. And so what we have there is a way that you can do that. Now, I'm sorry that you have a question if we have a written guide for this webinar, and that we do not. We do have these trainings, but the process here is, if you're familiar with insurance billing, there's an understanding of what insurance wants, and this is the process. So we can't explain your insurance company's process. We can explain a typical insurance company process. So let's go to corrected claims again. And down here you might have noticed that there is also an option for a voided claim. And if we click on that Notes Correct button, and we can see that, that's been marked, but there's an option there for a voided claim, and I need to go to a different claim number here to find that. And let's go right to this one. And if I click on this Edit button, maybe you sent a claim for a patient that wasn't yours. I have seen this happen once in a while. It's kind of weird, but you never intended to submit that to begin with, and you want to void it. You're not expecting a correction. You just want to tell the insurance company you need to void that. It should never have been there. So then you'd hit this void claim and put the claim number reference in there. So those are two different situations. Now, some insurance companies may not accept a corrected claim in the manner that we're proposing. Every insurance company is a little different. There's no standard between them as of yet. Some insurance companies may want you to print out a paper claim, write corrected claim across the top in a black marker, and make the corrections on it and send it to them by mail. Every company is different. You will need to look at your insurance company's requirements. But this process does meet the requirements for electronic corrected claims for the majority of insurance companies that accept electronic corrected claims. All right. So today we've looked at the process of submission of a claim. We've looked at the process of checking on after we submit claims and tracking those through the system via the Bad Claims button, messages, and the clearinghouse screen, and then the process of resubmitting problem claims and fixing claims and correcting claims and voiding claims. Okay, so those are typical processes that you will have in your group or in your practice. Now, if you do have questions about a particular rejection you might be getting or having a problem getting something through, we do want you to contact us. We do want to give you support in that. We have insurance claim specialists on hand with us, and all you need to do is go down on our homepage and click Contact Us and let us know exactly what you're having as a problem. So if you click the button, you can then get here. You can look at some help articles, but you can email us. And what that's going to do is you'll put the information, tell us the clinician's name, what's the patient's name, what's the date of service, what's the problem. And we can look at that posting screen for you. We can look at those rejection codes. We can look at everything you see for that accounting, and we can make sure and give you guidance on what needs to happen next. So the best way to learn about our system is to practice. And the way you practice is you start submitting claims. Remember, a rejection is not the end of the world. A rejection can always be resent. The nice thing about electronic claims is if you get a rejection, you find out about it typically very quickly within 24 hours. If you're sending in paper claims, you may not find out if it's rejected for weeks. So remember, rejection is not the end of the world. And if you're having a problem, and especially if it's the same problem over and over again, then you will be needing help with that. So question is, what is a turnaround response when emailing for questions regarding claim rejections using Office Ally? So if you are asking us and you send this email to us, typically you will have a response within an hour. I took a look this morning at questions that come in that our insurance specialists are working with, and I mean, if it came in, they were working it right then. So everything was responded to within 15 minutes, honestly. So there's things that we can tell you right away. This is what you do. This is how you fix it. And there's other things that maybe we need to investigate that a little bit longer. So it depends on how quick of a fix it is for you, if it's just something we need to tell you to do differently, or if it's a unique situation we haven't seen before. And that happens once in a while. Insurance companies sometimes just ought to change the rules all of a sudden and don't tell anybody. But we usually find out about it pretty quickly and find out there's a trend and help you work through that. Okay, so promise we're very responsive in this, especially if you're submitting this between 8 and 5 Eastern Time. Okay, we do respond to emergencies in evenings and weekends, but we get a really quick response between 8 and 5. And you can also call us. Okay, option 3 will get you to insurance, and we will be happy to help you with via phone call as well. All right, so we have covered a lot today. I've kept you for an hour, and I certainly appreciate your time. Please do let us know how we can be of further help. And remember, you're not in this alone. We're to guide you and make sure that you understand the process and help you out. We want you to learn. And also for groups who need help with billing, we can recommend some contractors who some of our groups work that they've recommended as billing persons who are very familiar with the software, and we'd be happy to refer you to one of those persons to talk with if you need someone to help you out, maybe part-time, full-time as a billing manager. So we have that available. And we will have a recording of this webinar today, so we do appreciate your time, and I will get this recording out to those attendees and make sure that you have it.